I was short-sighted from a very young age. I was picked up when I was 2, I think. Always had glasses. When I was a kid, I had the glasses that had to curl around my ears so they wouldn't fall off my face. And then as I got older and I was with older children who become more aware of themselves, I was bullied severely. And I battled with my mum for a long time to get the contact lenses, but as far as she was concerned, they were too expensive. Would I be responsible enough? So when I was about 14, 15, she finally got me the lenses, and that then was an absolute godsend. Constantly I'd be cycling around, I'd be swimming, and I'd be doing it all with my lenses in, which is not good for your eyes. If you're cycling with contact lenses in, you get bits in your eyes, and it's sore for one thing. I've nearly come off my bike as a result of it. And then swimming with your contact lenses, chlorine obviously isn't the nicest thing, so I'd either be swimming blind or damaging my eyes. So I have to carry a glasses case, solutions, sunglasses if it's sunny in London.
At the London Vision Clinic, we're not only about treating the average patient, in other words, the person with relatively small prescriptions and very straightforward eyes, but we're also looking to see what help we can offer patients with, for example, very high prescriptions. Not everybody's a true candidate for laser eye surgery, but there's often a lot of benefit that can be achieved through even partial corrections through methods called bioptics, using intraocular lenses inside the eye with a bit of laser surgery to fine-tune those lenses. And in the process, we can often give a lot of benefit to a lot of patients who may have been turned away from other clinics.
I looked through the internet. You get adverts now on TV. If you just type in laser surgery, it's all a sales trip. It was my general feeling. We can do one eye from 295 with a little star next to it. And I know it's just not going to happen, not with my prescription. You know, you'll phone them up expecting to get a price as low as that, and they turn around and say, no, it's going to be thousands more because I've got such a bad prescription. Whereas you look at the London Vision websites and speak to the people on the phone, they don't immediately throw the pricing. They don't immediately throw in, oh, well, we can do it no credit. That's not the first thing they're saying. The first thing they're asking about is your vision.
Perfect. Very good. Each person is an individual, and every eye needs to be treated as an individual eye. In other words, when we are trying to help somebody to improve their focusing and improve their vision, we are approaching them on an individual eye basis, so as to get the maximum out of their treatment profiles. I'm going to place this gently in front of the eyes. Isabella has a particularly unique prescription on her own because she has a very high prescription. She's quite short-sighted and she has a lot of astigmatism as well. She's the equivalent of someone who's around about -9, -10.
Going back to the day when I had the surgery, everyone was wonderful. They were all very calming, they were all very helpful.
Well, it's normal to be nervous. Everybody's a little bit nervous in the beginning. Even I was nervous when I had my surgery done. It's quite normal. But what we're going to do today is we're going to take things nice and slow. Okay, we're not going to rush anything. So if you're feeling at any stage a little bit apprehensive, well, that's one way of doing it, but certainly shouldn't be necessary.
No,
okay, now you'll be fine. You'll be fine.
He talked me through step by step.
Excellent. You all right there?
Yeah.
It wasn't too bad, was it?
Not too bad.
He told me what was going to happen next, always. What was going to move, what this noise was, what that noise was, where the lights were going to come from. So there were no surprises.
Excellent. Very good.
When I first was told I could open my eyes, I'm not sure I believed it. I was very bewildered.
Isabella, you can sit up. Swing your feet over towards my side. You'll see there's a little ledge there. Okay. And you can open your eyes now. Yeah, you can with pleasure. Now, it's going to be very, very hazy.
But I can see.
Of course.
I could see the clock. It was still a little bit hazy, but I could see the clock.
Wow. Thank you.
It's a pleasure.
Oh, wow. You sure you haven't put lenses in my eyes?
And the people around me, I could see their faces.
Genius. Absolute genius. Wow.
Don't rub them yet.
No, that's how I did that.
A very, very strange experience, which I don't think anyone could appreciate if they haven't had bad sight before.
I can tell the time. It's 25
We can
past
tell the
one.
time? That's right.
Thank you so much.
It's a pleasure.
So much. Oh my god, I don't believe it still. Why is a cat riding a shark?
Hi Isabella.
Hello.
How are you?
Yep, very good. Very good.
Comfortable now?
Yes.
Excellent. You won't be needing those anymore?
No, I won't.
Excellent. So do you want to donate them to charity? They're going to Africa.
Why not?